I was diagnosed with invasive ductal carcinoma, breast cancer stage 2A, and these are the treatments I went through. The first treatment was the surgery, and I had a lumpectomy at my oncologist's recommendation. Unfortunately, that first lumpectomy turned into 2 lumpectomies because the margins were not clear the first time around. That meant that there were still some cancer cells a little bit too close to the edge on the tissue sample, so the oncologist decided I needed to have another lumpectomy to get any remaining cancer cells out. During that first lumpectomy, they found out, unfortunately, that the cancer had spread to the sentinel lymph node, which is the first lymph node closest to the breast, and I would need chemotherapy. I had a port placed. You can see my scar from my portacath, and I went on to have 4 rounds of the Red Devil chemotherapy and 12 rounds of paclitaxel. The chemo was tough. The Red Devil was the toughest for me, and after the 3rd round of that Red Devil chemotherapy was the round out of all 16 where I felt the worst. But when I had that 4th round of the Red Devil, I felt better, and I think that was actually because I knew it was the last one. The 12 rounds of the paclitaxel essentially put my body into a forced chemical menopause. So there were lots of other things I was dealing with, like the constant hot flashes, lots and lots of joint pain. I had steroid-induced acne towards the end of the treatments and quite a bit of weight gain. But I got through it, and then I waited a few more weeks until it was time for radiation. When I went into the radiation clinic, the techs, who I absolutely loved, they became like family because I was seeing them so often. They said to me, you know, you have very fair skin, and you might be surprised because sometimes the people with the fairest skin end up burning the least. I was surprised to hear that, but it actually, in my case, turned out to be true. And I went through 25 rounds of radiation in about 5 weeks. I only got red towards the very end of my treatment cycle. After finishing radiation, we waited 3 months, and I had a PET scan to see if the cancer was gone. And it was. So I found out on November 20th, 2024 that I was in remission. I've been taking letrozole for the past year. Letrozole is an aromatase inhibitor. That's because my cancer was hormone positive, which means that estrogen, which is that beautiful hormone that keeps our skin nice and plump and our joints feeling great and lubed, was